The National Health Foundation is a 501c3 organization. We have 3 strategic initiatives. One is uninsured children and families. The second one is chronic disease management. And the third one is systems change. And we organize all of our program activities under one of those 3 initiatives.
Hospitals in Los Angeles County are faced with a dilemma, and that dilemma revolves around discharging their homeless patients. What happens is the hospital has this patient and has nowhere to discharge them and is left with 2 options. Either they can keep the patient in the hospital for an average of 4 days longer than necessary, or they can discharge them to the streets. Neither option is a good option, and both options cost the healthcare system at large.
We are at the Recuperative Care Center in Los Angeles, which is located in the mid-city area of LA. The Recuperative Care Center is actually a program that was set up specifically for the hospitals in Los Angeles and Orange County to have a safe discharge plan for patients that are homeless. In this particular case, the hospitals have a safe option for their patients to go to a center where there's a bed for them that's clean and safe for their recovery time. One of the things that's primary for the goals of our hospitals that we've partnered with is that they understand when a homeless patient comes to the Recuperative Care Center, the National Health Foundation is on the forefront of being their point of contact to have a safe discharge and a successful intake to the program in itself.
When I first came here, I was a total mess. I have what they call terminal diabetes. They came by every morning, they made sure you took your insulin, and then you got 3 meals a day. Everyone here genuinely cared.
Our recuperative care sites are staffed with registered nurses, social workers, and site managers. And it's this staffing combination that allows us to provide the best atmosphere possible for our homeless to recuperate.
First off, they get the medical oversight piece from an on-site nurse. For the duration of their time in the program, they also have a social worker that will meet with them and see what is missing in terms of their vital resources such as California ID, SSI, general relief, just things that basically they are without. And then ultimately at the end, during the time of recuperative care, they're actually trying to get them connected to housing options. So the Recuperative Care Center, located in Los Angeles here, this is one of the rooms. The person that comes in basically has a clean and stable environment. They're able to stay at the Recuperative Care Center up to 10 to 11 days, but ultimately what they have is basically their own bed, a refrigerator, a microwave. It's already pre-existing space that has been converted for their use of a recuperative care. So the motel setting in itself is a cost savings when we look at this program. Over the course of the last 3 years, we now have a total of 63 hospitals that participate in using the Recuperative Care Center. And the average cost for an inpatient bed, the average was over $2,600. For the Recuperative Care Center bed, it's $250 a night. Hospitals have spent $4.4 million on their utilization of recuperative care, but in essence, the cost savings to hospitals is over $12 million.
We are very happy to partner with the Illumination Foundation in all of our recuperative care programs.
Ultimately, this is a partnership that has really produced a lot of benefits, not just for our organization, but the community as a whole, and obviously the patients who are homeless coming into the center. Okay, that's very good. Okay. Feeling better?
A lot better.
Sleeping better?
I was sleeping a lot. Okay. Recovering well.
They genuinely do want to see you get better. They genuinely do want to help you get a place to live if you're homeless. And when that happens, when you meet people like that, it does something on the inside with your spirit. If it wasn't for this place, I would be dead.
Plain and simple, National Health Foundation's mission is to bridge gaps in healthcare. We feel that no matter who you are, your socioeconomic background, your cultural background, that you deserve access to healthcare the same as everybody else. Our mission is to make sure that that happens.